Okay, I'll take just a little bit of a different approach. As I am the Director of Beef Quality Assurance, we've worked with the VFD regulation and trying to do education within our beef industry here in Nebraska over the past year. And so we this just main recently, probably not as far as Wisconsin has gone with educational pieces, we felt there's that need to look at how we educate our youth. And everybody kind of understands maybe some of the process behind why the VFD was incorporated into FDA regulation, and it all comes back to some basic things: antibiotic resistance, how it affects human health. They see a big overuse of antibiotics by tonnage by the livestock industry, and we have used them probably to help increase performance, but mainly for health of the livestock. And so we need to make sure our youth are part of this discussion. And so understanding that is probably the key, and that's kind of the direction we kind of took with a piece that we have developed, and actually just went out to our folks that I'll show here in just a minute. Probably wanted to give another piece of background is this antibiotic resistance is not a new concept. It's been around. A couple things that I like to bring out just to keep everybody on the same page is we have to be concerned with antibiotic resistance both in livestock and human medicine. We're talking mainly about livestock today, but it's real, it's out there, but some of the things that we found is from the Center of Disease Control, penicillin was actually introduced in 1943. Resistance was identified in 1940. Tetracyclines, which are probably our most popular in both human and livestock industry, was introduced in 1950, and there was already resistance occurring in 1959. So this is not new. It's just how do we work with our producers, both young and older producers, to make sure that we are following these regulations. And that's kind of what this is about, is how do we teach the youth what they need to do and where we need to go. We also reiterate the fact is the key is having these youth producers visit with their veterinarian, and we found as we kind of discussed how we were going to do some things here with a flyer in Nebraska, how many of our youth might not have a specific veterinarian that they have worked with or that they know, and that's something that's probably still number one in our youth quality assurance programs, is having that relationship with the veterinarian. But have the discussion with your veterinarian, but also your feed supplier. And I think that's a key when we're talking to these youth, because some of our youth don't know what all might be in their feeds. And so they need to understand, is my feed that I'm using or have used, is it medicated? What's it medicated with? And am I going to be required to have a VFD, or is it a medication that doesn't require a VFD? So now our youth are having to go and have those discussions to really think about what they are doing with their projects. And we're seeing a lot of feed companies now, some of those feeds that we've used might not be the same products these youth have used in the past, because they might not be medicated like they had been before. And we all know that there is no extra label or off-label use of feed-grade antibiotics or antimicrobials. And so those youth need to, we just need to help educate them of what that means. We do have some leeway with minor species, as Dr. Eirich had mentioned, is some of those minor species, which would be considered our sheep, goats, those type of animals are where we don't have a lot of options that are available to us for medications. Veterinarians are going to have some leeway to develop prescriptions that will, in VFDs, that will allow them to use some of these products, but they have to still be within the realm and within the label of what what the FDA will accept. And so there's some options there, but they still have to have that initial discussion with their veterinarian, because again, to reiterate, vaccination programs and preventative programs is going to be the key that we need to look at, that where we don't have to treat diagnosis. And the thing is, with these products now going to a VFD, antimicrobial that requires a VFD can only be used basically for three things: prevention of a specific diagnosis that's on the label, control of a diagnosis that's on the label, or the treatment for a diagnosis. So when we look at that, those are very specific to what we're doing with those products. And so understanding that, sometimes we need to look at how do we work with our youth to help them understand if their animal is ill. What are we looking for? What are the symptoms? We need to work with a veterinarian to get a diagnosis. That way we're treating them properly and judiciously. And so those treatment plans and those type of things are all going to be involved in this whole process. But they also need to keep records again. And again, quality assurance on all levels has really started to implement those facts. And we're going to see more about the BFDs coming in a lot of our quality assurance programs as well. So here's kind of what we have developed here in Nebraska for our youth program to get it out. We anticipate that our educators' assistants will have this available to our youth families involved in livestock. And the thing is we have to remember this involves all food-producing livestock. So cattle, beef cattle, dairy cattle, poultry, sheep, swine, dairy are all involved in the VFD scenario. And so again, we talked about a little bit how you go about getting a VFD. Remember, a VFD has to have a valid signature from a veterinarian, and that requires you to have a relationship with that veterinarian. And so again, understanding what that whole process is, that's a part of what we're trying to educate. But we also developed a sample feed label that we want folks to look at and use. Again, it talks about how do we know it's medicated? Where do we find that label? Where do we find what it's medicated with? And again, it shows on this feed label to the right. And then on the very bottom, it's also always going to state that it's a federal regulation, and federal law restricts how medicated feeds are fed and what kind of orders have to be in place by an official veterinarian or a valid veterinarian with his official signature to get those products purchased. And so that's kind of what we developed for that part. And then we talked about some of the products, the antimicrobials that we know that are used within some of our youth programs that are linked here. But yet, what are those common names? What are the active ingredients? And that's kind of the list we have there. And then just a simple 7-step process of what they need to do, very similar to what Wisconsin done in theirs. Just kind of explain those steps of where they need to go, what they need to do as far as getting those processed. And then a simple checklist. Do you have a valid relationship with a veterinarian? Yes or no? Have you discussed your herd health plan with a veterinarian, or what you might encounter that will require you to treat, or what can you use to prevent something from happening? And then the third one is, do you plan to feed any medicated feeds? That might be a discussion you're going to have with your feed supplier. What have you used in the past? Is it medicated? What's it medicated with? If you're going to answer yes to that, then you have to really sit down and have a discussion. What are those products in that feed? What's it medicated with? Because I'll give an example in the beef cattle industry. Some of our show feeds will have Rumensin or Bovatec in that product. Those are ionophores. They're still medicated feeds, but those products don't require a VFD. So in that case, the veterinarian won't have to write you a VFD to purchase that. But if you have a product like CTC, which is very common in some of those show feeds, that product is going to require you to go to a veterinarian and get a VFD. But what is that CTC being used for in that mix? And so there's some discussions you're going to have within the realms of talking to your veterinarian and your feed supplier, because those are questions that we're going to have. And so that's why we continually talk about how does that feed work? Is it medicated? What can we use? But we've had some discussions with some of our show feed manufacturers. They have done a lot of changing with their mixes and their product, and they have pulled out a lot of the medicated product out of those mixes. So the actual complete feed might be the same, it just might not have the medication in it. So just making our youth aware of that, what was in there, why was it in there, and how will it affect my animal if I don't have it in that product. Again, CTC is the most common that is being out there in most of our species. We also have some Lincomyx or lincomycin that is very common in some of our show feeds for swine. And so, again, having that discussion and consult with your feed distributor or your supplier to know what products you're getting. That way you can be prepared ahead of time. We also thought that there's some opportunities to get a hold of us. We worked very closely with the Nebraska Department of Agriculture to create this, and both of us have resources available in websites. Mine actually is at the Nebraska BQA page, and then our Department of Agriculture has a page, and those links are shown here. Another general place where we can find information on VFDs, it's probably more in depth than maybe some of our youth contacts or our youth families might want to get into the VFDs, but the feedstuffs.com, they have what they call VFD Central. So it's that website is also, the link is there under the resources here. So again, there's some opportunities for us to learn more about the VFDs, and I think I'll try to kind of conclude there and kind of open it up to questions that you might have that I'll try to help discuss and go through some conversations here that we might have. So.
Thank you, Rob, for wrapping up the veterinary feed directive topic. So if you have some questions, please use the chat box. That feature you can see is on the bottom tab of the Zoom window. So go ahead and click chat and then type your question in. Kind of start us off, Rob, if you encounter a new parent who has a first-time child having a livestock project, what might be your approach to kind of just introduce them to the VFD?
Well, I think the first approach is understanding, kind of visit with them about what their project's going to entail, what species, what are they doing right now, what's their operation look like, and then visit with them about starting out with just basically animal health. Where have you gotten these animals from? Have you talked to that producer about what they might have had as far as vaccinations and those type of things? But then once you kind of get to that point, you have a background of where to start with a new family. And then you can kind of start stepping through, well, have you talked about what you're going to feed these animals? A lot of times with new families that might not might have just started into the program, a lot of times they will choose to go with a more complete feed that is purchased instead of mixing some of their own. And with that, then you need to kind of go into, okay, have you talked, where are you going to get this product? Visit with those folks about, okay, if we have this feed, what might we encounter that we might have to treat? Sometimes, like, if it's something simple as, well, we're going to have to worm these animals once or twice, those products we can get additional to top dress our feed that's not medicated, but we don't require a VFD for those products. And so, again, a lot of times in this scenario, it's simply talking about a herd health program and making sure that they understand when animals are sick, what to look for, and those type of things. And I think that's probably the basics of starting with this whole VFD process. VFD, I think it's probably one of those things that some of these participants might not have known that their complete feed was actually medicated with one of these products to start with. So,
thank you, Rob. So in the chat box, we do have, to help people better understand the human-animal antibiotic relationship, what are some resources you would recommend?
when it comes down to understanding the interaction between human and animal antibiotics or antimicrobial relationships, some of my best places where I find a lot of my resources on that side of things would be directly from the Food and Drug Administration at fda.gov, or some of the other places. The Center of Disease Control has a very good website on the interaction of these antimicrobials between human and animal, the relationships there as well. The other one is actually the Department of Health at Minnesota has put together what they call, I believe it's Health One, that has done a great job in talking about the relationships between the human and animal antimicrobials. And I hope I kind of answered that question for you, Lindsay.
Thanks, Rob. Go ahead, continue to type in your questions into the chat box. I think one comment too to kind of add is Bernie really laid out that Wisconsin had a plan going into their 4-H programming and making sure they really touched base with those exhibitors and those families. So I think that was really a good take-home message, is this is something new and it does impact our show animals, and we do need to make sure that at the exhibition level we have some form of plan in place at each state level or county level, whatever the show might be, to help people understand the regulations. But then also, do you have some plan in place how you're going to approach if there is a problem that arises?
I will speak to a little bit about FDA's approach about kind of doing some audits, investigations. This first year, a lot of it's going to deal with some of the things that we would be more education, and just to make sure that these forms are following the right track of, because the form itself, the veterinary has to keep the original copy, and then another copy has to either go to one copy has to go to you as a client or a producer, and one copy has to go to whoever supplies that product. And so it's going to be an educational piece for everybody involved to start with. So just to kind of keep that in mind.
Well, great. Thank you, Rob, very much. I don't see any other questions coming in right now. So I just want to thank everybody for attending. I did put Dr. O'Rourke's email address in the chat box there for you, so you have that easy access. And I am also typing in the Animal Care Wednesday webinar website. So when we get this recording posted up here next week, we'll have that recording available at the website. You can also check out some of the previous recordings there as well. Our next Animal Care Wednesday webinar will be Wednesday, February 1st at 11 o'clock Central Time. So do know that it's 11 o'clock Central. And our speaker will be Dr. Mike Appley from Kansas State University, talking on antibiotic resistance and the stewardship of that. So thank you everybody for attending and have a great day.